So today we are discussing mm, regulation, regulation of arterial pressure. Regulation of arterial pressure. How atria regulate pressure? Simple meaning of this. Like it's atrial pressure regulated by some baroreceptors. Baroreceptor are the point or receptor, as we can see that mainly process the blood pressure and all regulate the blood pressure. Okay, so here we can see, like, if you imagine this is a heart. Okay, from here the aorta is going there, this aortic arch. Here is external carotid artery, internal carotid artery, and here is carotid sinus. Like we can see that carotid sinus, we can call it. The two receptors are there. First present in aortic arch here, the number one, and the second one is present in the carotid sinus. Both are baroreceptor, but for the second one, it's something special. I don't know why. Purification point, we call a special treatment of this. Okay. Basically, it supplies with different types of cranial nerve. Like first, the upper one is supplies with the ninth cranial nerve, also known as glossopharyngeal nerve, and the lower one, like the carotid sinus, supplies by glossopharyngeal nerve, but the aortic arch is supplied by tenth cranial nerve, is vagus nerve. Okay. Huh. How it's work now, we have to look about this, like how it's work and all the things, how to regulate, like basically how regulate, like how baroreceptor regulate our blood flow, blood pressure. Simple. Hmm. So let's imagine, like, if our BP suddenly goes down. Here I already written, hmm, like suddenly our BP goes down very low. I don't know, just sudden. Anything can be cause. So basically, what happen when our BP goes low? The stretch and wall decrease. Like it's totally normal. Like if BP is going low, like blood is not filling the bag or something. So the stretch and bag get reduced because not totally filled by blood and all. If a stretch get lows, now here we can look. The impulses also get lows. It's get decrease. Stretch and wall decrease. Impulse decrease. The overall body face a drastic change. So the nerve supply goes to the nucleus, like basically goes in the medulla. There is nucleus of solitarius present. Like you can see that nucleus of solitarius. It work as the reviving center, we can call. So like medulla see what is going there or not. The sympathetic nervous system activated at that point with the help of solitarius. Like nucleus of solitarius activates the sympathetic nervous system. And as we know, the if sympathetic nervous system on, the parasympathetic nervous system get lows down and all. Sympathetic nervous system, also known as fight and flight, basically it's increase the blood flow, like heart rate. It increase the heart rate. If the heart rate increase, the contractility of ventricle increase, and simply the BP increase. That's all we have to